Good afternoon. Thank you all for joining us today. This afternoon, I am pleased to be joined by Chris Van Gorder, who is President and CEO of Scripps Health, as well as Dr. Janelle D'Onofrio-Oudman, who is the EMS Medical Director of Emergency Medical Services at Rady's Children's Hospital, as well as the City of San Diego's Associate Medical Director. I've often highlighted over the last several weeks some of the heroes who are on the front lines of this crisis. And of course, it is San Diego's medical professionals who are leading the charge against COVID-19. Nurses, doctors, healthcare professionals, you all are San Diego's heroes in this fight. And so on behalf of all of us, all San Diegans, a grateful mayor, I want to thank you for all that you're doing for us day and night. In this afternoon's briefing, I will be discussing the following topics. First, I've issued a directive to make all available city property to be available to accommodate medical needs during a surge in COVID-19 patients. Second, I will give an update on the actions we took earlier today to protect homeless individuals. Third, I will give a daily update on our public safety professionals with respect to COVID-19. And fourth, I will talk about conversations with federal and local officials. And lastly, as I do every day during these updates, I'll highlight San Diegans who are really stepping up and helping our community. Earlier today, I joined regional leaders to help transform one of San Diego's most important properties, the Convention Center, into a centerpiece against the fight of COVID-19. It is a powerful example that shows we are bringing all resources to bear to protect the health of all San Diegans. The Convention Center was just the first public property to undergo a transformation during this emergency. Today, I'm also formally announcing that San Diego is taking things to the next level. To accommodate the expected surge in COVID-19 patients, the City of San Diego will be offering up available city property. I'm doing this in anticipation and in expectation that our hospitals will need all of the help that our community can offer. As we are seeing in New York, which has not even hit its apex yet, we need an all-hands-on-deck approach. And if we need this space, if we need city properties to help battle COVID-19, whether it be for a field hospital, for staging equipment, or for conducting medical tests, my order ensures that the City of San Diego is ready to help in any part of the city. The federal government, the state government, or the county government, or a local hospital need land, they have a friend in the City of San Diego. Examples include our recreation centers, our libraries, which are currently closed to the public. Even city parking lots can be utilized. Anything we need to do in partnership to prepare and to get the job done. In fact, as I think many of you know, the stadium parking lot has already been activated by the County Health and Human Services for medical services. And of course, space is just one resource we need in this battle. The most important resource we need is time. We need to stretch out the spread of this virus over a longer period of time so hospitals do not get overwhelmed all at once. This is what this fight is all about. That's what flattening the curve is all about. And this is where San Diegans continue to come in. The storm is on the horizon, but it's not here yet in San Diego. And as we wait, as you wait, many may want to relax your physical distancing, may think you can wash your hands less or leave the house more. That is exactly the wrong behavior. And that type of behavior would spread this virus. If we let down our guard right now, all of our sacrifices to this point could be lost. More people will spread the virus. More people will get the disease. More people will end up in the hospital, all at the same time. This is the chain of events that could crash San Diego's healthcare system. And so as we continue, as we're several weeks into this, some San Diegans may feel like they should go back to our old habits. And so this is why I want to amplify in the strongest possible terms the message coming from all of our great healthcare providers, whether it's Scripps Health, UCSD, Sharp, everyone. Complacency is the enemy. I'll say that again, complacency is the enemy. So everyone watching and listening to this right now has the power to help stop this from happening. Every San Diegan has the power to help our local hospitals from becoming overwhelmed. Every San Diegan has the power to save lives, to stay home, to stay safe, and to stay motivated. Before I hand it over to Chris Van Gorder with Scripps, I want to touch on a few other updates. Today, I joined regional leaders, Supervisor Fletcher, Councilmember Ward, and other folks to launch Operation Shelter to Home, a regional effort to prevent the spread of the virus among our homeless population. The convention center is a welcoming beacon for people from around the world. Starting today, it is a beacon of hope for our community. As I mentioned this morning at the event, it is more than a shelter for homeless individuals. Not only are we going to help secure individuals' health, we're going to secure them housing. So I'm happy to report that as we are speaking this afternoon, the last of nearly 400 people from 2 of the city's bridge shelters have been moved today into the convention center. And as those folks get situated, we will ramp up our teams to move to our next bridge shelter, and so on and so on. And then we will look at the capacity and increasing that capacity to bring in unsheltered men and women from our streets. I would like, again, to thank all of our partners, the Regional Task Force, for their efforts today. Stay tuned as I continue to give more update on the capacity and the folks that we are able to help out there. Next up, I want to give an update on our public safety officers. I mentioned yesterday that there had been a total of 7 public safety professionals that have tested positive, 4 lifeguards, 2 police officers, and 1 firefighter. We have not received any positive tests at this time. In fact, we do have 1 police officer who has since recovered and was medically cleared to go back to work today. This is a good story to mention because while all of us take this virus seriously, you can recover, obviously. Good news for that officer. Next up, updates for our local and federal partners. I joined other California mayors on a conference call with Senator Kamala Harris this morning. Let me say I appreciated the time the senator took to speak with all of us mayors across the state. I had the opportunity to speak with the senator about the work that we are fighting for long-term housing dollars in the next stimulus bill that they are working on back in Washington, D.C., which is something that we can hopefully expect in the future. We also talked, and I talked about the need to ensure that we have dollars that we could acquire and rehab hotels and motels to help house homeless individuals. So all of the work that we are doing on a temporary basis, keeping in mind the eye to make this permanent. Today I also joined via Zoom the Southern California Leadership Council, a group of business leaders from throughout Southern California, as well as Governor Newsom and former Governors Schwarzenegger Davis and Governor Wilson. We had the opportunity to discuss topics ranging from our healthcare capacity, which is on all of our minds, as well as to the efforts that we're all doing in terms of economic recovery when we get on the other side of this, and the regulations that we will need to change now as a state that allow us to make that recovery as soon as possible. Now it's my pleasure to turn it over to Chris Van Gorder. Chris, as I mentioned earlier, is President and CEO of Scripps Health. Chris recently, as I think many of you saw, issued an open letter to San Diegans urging folks to continue to take physical distancing seriously. I want to take this opportunity to thank Chris for all of his leadership and all of the medical team at Scripps and their healthcare responders from across the region. As I mentioned earlier, we are immensely grateful and motivated by the bravery and leadership that our healthcare professionals are doing for us every single day and night. Chris?
Thank you, Mayor, and thank you very much for the nice introduction. Complacency is indeed the enemy. In fact, I'll go a step further. Complacency will cost lives. I often think of this healthcare emergency that we're in is like a tsunami. We can actually see it. We can see it coming in. We just don't know how big it's going to be and how many lives it's going to take. It's unprecedented in our history. It's unprecedented in healthcare. But we're also seeing unprecedented collaboration between our healthcare systems. I want you to know that. Under the county, our public health officials, all of our healthcare executives around our county getting together at least once a week together to talk about how we can prepare together. So we're not preparing just as individual hospitals or even as individual doctors. We are preparing our healthcare community to help take care of this community as COVID gets worse in the weeks and hopefully not, but months to come. Not only is this unprecedented in a lot of ways, but like I said, I'm really concerned about complacency. Last week, I was driving just in the Kearny Mesa area after leaving work, and I got a traffic warning. That concerned me. For a while, it seemed like there were a lot of people off the road. Now it seems to be coming back again. We had our first death from COVID-19 in our hospital yesterday. One death is too many. We are already up to 15 in this county. Those numbers are going to continue to grow. If we do not do what our public health officials have recommended, and frankly, our courageous elected officials have done, by asking us to shelter in place, if necessary, close our businesses, and hopefully stay at home, which is by far the safest place you could ever be. If you're at home, you will not be infected. If you're in the public, and sometimes you will have to go to the market or something like that, but if you're in the public, you have a risk of getting infected. So the safest place to possibly be for all of us is for you to be at home. But if you stay at home, you're also protecting our healthcare delivery system. The more people that get sick, the more people will ultimately be in our hospitals, and we could easily overwhelm our healthcare delivery system. We've done our own profiling, and if only 30% of our community sheltered in place or maintained appropriate social distancing, we could overwhelm our healthcare delivery system by June. We would probably run out of supplies even before that. So while I've encouraged and applauded our courageous leaders for making the decisions they have, and by the way, they've been criticized. When you act proactively, sometimes before it's needed, that's when you're criticized. You can get a lot of public attention when you react too late, as has happened in some parts of our country already. So what I would ask and continue to ask is that our elected leaders continue to act proactively. Let's tighten up the regulations. Let's make sure people are staying at home. Let's make sure we save and protect the healthcare delivery system. If we do that, then the spike we're seeing in New York and other places in our country may not happen here. It's incredibly important that we flatten the curve. Give us time. Give us time so that we don't overwhelm our healthcare delivery system, all the beds that we have in a short period of time. If that happens, we have to make very difficult decisions. Who gets care and who doesn't get care? Who gets a bed, who doesn't get a bed? But if we can flatten the curve and push this out, it gives us time to not only take care of our community, but it also gives us time to come up with treatments and hopefully downstream a vaccine or something like that that will help us all in this situation. So the last thing I wanted to do is praise our healthcare providers, our doctors, our nurses, all those people on the front lines. I was in law enforcement for a number of years, and I think as a law enforcement officer, you go to work recognizing you may be putting your life at stake. Our doctors and nurses have not gone to work overtime expecting or thinking that they may lose their lives. But today with COVID-19, that's a possibility. Now we're doing everything we possibly can to make sure they're protected and that they have the supplies and the equipment that they need. But if we get overwhelmed, we will not have the supplies and equipment they need, and that could endanger them. So I plead with all of you, follow the regulations. Let's tighten them up if we possibly can. Let's not let San Diego become New York. Complacency is the enemy. Complacency will kill. Thank you.
Thank you, Chris. Again, thank you for everything that you and everybody at Scripps and all of our providers are doing. Thank you for stepping up for our entire region. Next, it's my pleasure to welcome our City of San Diego's Associate Medical Director, Dr. D'Onofrio Oudman, who will share some of her thoughts. Doctor?
Thank you, Mayor. Citizens of San Diego, as we all know, COVID is here. My medical colleagues in New York and across Europe are sharing frequent reports of the war that they're fighting in the hospitals, the shortages of equipment, not having enough hands on deck to care for the numbers of critically ill and dying. These are really scary times. To know that a hospitalization during COVID is a hospitalization without your family at your bedside. Almost 20% of those who get COVID are going to get hospitalized, 5% in the intensive care unit. I never want to have to choose who gets an intensive care bed, who gets a ventilator. I don't want any of us to have to make that decision. We want every citizen to get the care that you need should you require it. But this message isn't to scare you. This message is actually to bring you hope. We've been working around the clock. As our county EMS medical director, Dr. Koenig, actually points out, we're gathering and preparing the 3 S's: structure, staff, and stuff. Our first responders, fire, EMS, police, they've been collaborating closely with the county, with each other, all the agencies across the county, and major metropolitan cities across the nation to optimize our response. We're preparing our battle lines to be able to provide you the safety and security you need when the waves of COVID increase. Our hospitals, the ERs, the wards, the intensive care units, every part of the hospital on every layer and every hospital system has been working together at a level that is unprecedented. We're moving forward with innovative and future-thinking ideas to try to combat this problem. We're supporting each other and we're preparing ahead for the storm. Our political leaders and industries have leaned forward to obtain supplies, testing, and they're looking to science for solutions. We are preparing to be ready because the lives of San Diego citizens are our #1 priority. And you guys, everyone who's watching me, the citizens of San Diego, you've done some heavy lifting so far. With your social distancing, hand washing, staying home when you're sick, adhering to the mandates that were put up for your own safety, it looks like maybe we're flattening the curve. My fingers are crossed and I'm really hopeful. Mr. Rogers said that when he was young and he saw something scary in the news, his mom would say to him, "Look for the helpers. You will always find people who are helping." I've watched teachers come up with new creative and interactive school lessons for the kids who are at home. Karate senseis come up with Zoom karate lessons, online piano teaching. My friends, heck, my mom had started sewing masks for their communities. We've had other people start making face shields for the healthcare workers. Our community has stepped up. We're supporting one another. We're remembering the importance of kindness, compassion, and friendship, that a smile can cross the 6-foot barrier. These are unique times that are bringing out the helpers. Now, what we need to do is keep up the battle. There's a scenario that's shared by a Yale infectious disease epidemiologist. Fancy words, I know. But I think it describes the complexity of the need to truly break the chain of infection by limiting all non-essential contact. So he describes, if your son sneaks off and visits his girlfriend, and then you later sneak over to have coffee with a neighbor, then your neighbor is now connected to the infected office worker that the son's girlfriend's mother shook hands with. Social connections are complex, and we need to maintain a very high level of awareness. We need to hold strong and continue our protective efforts, because we're not going to know how we're doing with the curve until mid to late April, hopefully. And we need to protect ourselves until we have a viable vaccination. I'm proud to live in San Diego, to work with this amazing collaborative community, and I'm in awe with how well we're dealing with our new surreal reality. We can do this, and together we will save lives. Thank you.
Thank you, Doctor. Very well said. Finally, I'd like to conclude, as I always do, with some stories of San Diegans that the doctor just said continues to step up. We are a proud military community, and just like everyone else, our service members and our veterans are facing very unique challenges during this crisis. That's when Al, a U.S. Marine Corps veteran, stepped up. Al is a board member at the San Diego nonprofit Us for Warriors Foundation. He recognized the unique challenges that our veterans are facing and growing during this COVID-19 crisis. And he feared some folks might fall through the cracks because they didn't have access to transportation to get the supplies they need. So he began to personally checking in on veterans in his own network through the foundation. And everything that they needed, he took it upon himself to deliver. Meat, bread, fruits and vegetables, toiletries. He made sure that no one was left with an empty pantry. So Al, I want to thank you for stepping up for our veterans. You're a great example of our veterans community helping each other. I also have a story of a San Diego business stepping up, Protector Brewing Company, located in the Miramar area. This veteran-owned business decided to adapt their operations by offering pickup and delivery so San Diegans can still enjoy their organic craft beer. But Protector Brewing didn't stop there. For every pickup and delivery order placed, Protector Brewing is donating $1 to Veteran Service Organization's Team Rubicon. Team Rubicon serves communities in times of crisis by mobilizing veterans to help people prepare, respond, and recover from disasters. It's clear that San Diegans continue to step up. Every little thing helps somebody else. And so whether it's a simple check-in on a friend or helping to get some groceries or supporting a nonprofit, our city's great care and compassion continues to shine through during this crisis. These stories not only help us to know where to turn for a helping hand, but really help keep our faith in one another. Because when we get on the other side of this crisis, and we will know it was because we stood together to help all of us get through it. With that, I will conclude these items on today's briefing, and I'm happy to answer any questions.
Good afternoon, Mayor. Guillermo Mendez with Univision. Thank you so much for having these daily updates, first of all, to keep us informed. Now, the county released a number of positive cases by zip codes, and it shows that 92103, which includes Hillcrest, has the largest quantity with 57 cases, more than double than any other identified location. Also, zip codes adjacent like 92104 North Park area and 92116 Normal Heights are in the top 5 of the list. Why is this, and what are there going to be any additional precautions that the city is going to be taking?
Yeah, no, I appreciate the county being transparent and putting those numbers out by zip code. And I would refer to the medical professionals in terms of their comments on locations and others. But it is important to show that, and it's a good reminder for everybody in every neighborhood, whether in the city of San Diego or the county of San Diego, that this virus is real. The physical distancing and the spacing that we're talking about is real. That's how you protect your neighborhood. That's how you protect your community. And that's how we will get on the other side of this curve.
Are there any additional precautions that the city is going to be taking in these areas in particular?
We will continue to work with all of our, as I said, our healthcare providers, our county public health officials. The number one thing that we can do to stop this spread, which is why our medical professionals are here with us today, stay at home, do social distancing. That's how we get across this sooner rather than later.
And exactly. One of the things I was thinking is police, I'm not sure, are they enforcing more? I mean, are they noticing that people are not social distancing in these areas? Is that something that you've heard? Or? It's a constant
effort. Our officers are out there, our firefighters or lifeguards are out there, and San Diegans, by and large, are absolutely doing the right thing. I use these briefings often to say thank you, but also a very strong reminder, we need everybody to do the right thing. Our officers obviously are out. Enforcement is a very important tool, which we will continue. But it's all of us by working together that we're going to get on the other side of this.
Thank you.
Thank you. Any other questions? Doctor wants to add one point. Of course you can. Come on.
Thank you, that was a great question. I would caution you to looking too much into where the positive tests are coming from. So as you remember that we have only a certain amount of tests, and so we are prioritizing who we are doing COVID testing on with the highest priority with our healthcare personnel and first responders and people who are hospitalized. So what you'll find is probably you're going to see more of where those people are living rather than who is truly infected with COVID in our community.
Good point, Doctor. Very good point, Doctor. Thank you. Yes, go ahead.
I do have a question. Jackie Cray with NBC7.
Of course, Jackie.
In New York, where they're using those fields to set up hospitals or other locations,
Yeah.
and they're moving patients that are less severe from the hospital and clearing those beds for actual COVID-19 patients. Is that kind of what's going to be happening here?
It can be, and again, why we're taking the actions that we're taking is to prepare. If we need city-owned facilities, we will be ready. The executive order I issued earlier in the week, also it said if city workers are needed to help, we are ready as a city. So all of this is designed to give us the help, the forces, the capacity that we need, and to do those plans now that our healthcare providers are ready to work on a moment's notice.
Thank you.
Thank you.
Hello there, Kasha from Fox 5. Is there any information about where our hospitals are at right now at this point in time with capacity of patients?
Kasha, I think the county's giving updates on those usually during their press conferences in the afternoon. So I believe you'd be able to get that in terms of the capacity for each individual hospital.
Okay.
Thank you. If that concludes our questions, I want to thank both of our speakers for joining us today. A final thought of thanks to all of our healthcare professionals. There's one thing you take away from today's briefing: everybody can do their part. This is going to help this city and this region, and we need you to do that. Thank you. Good afternoon.